Hello and welcome to our program. I'm Lauren Collier. We all hear about a celebrity that has overdosed on drugs, but seemingly overlooked are the tens of thousands of lives that substance abuse destroys across the United States. And in fact, in many places, that number has been on an alarming rise. So how can we begin to deal with these huge drug abuse problems? With me today is Dr. Raj Juneja. Dr. Raj is a triple board certified psychiatrist in New York and New Jersey and chairman of the Ocean County Opiate Task Force in New Jersey, which, by the way, is one of the areas that has been particularly hard hit by this devastating epidemic. Dr. Raj, what is happening in America with addiction to opiate drugs?
Lauren, thank you for having me here today. What's happening in America is absolutely alarming. With respect to opiate overdoses, the CDC now is reporting that more people are dying from overdoses from opiate medication and heroin than traffic fatalities. It's a major, major problem.
So, who does this really affect? Is this anyone at really sort of any age?
Absolutely. I think one of the most alarming patient situations in the sense of what age somebody started is when somebody told me 12. I said, what was that? 12? He said 12. I said, my gosh. So the kids have access to this at a younger and younger age. And, in general, we have been a country of disease management. And we're moving towards, and really, this is what I believe is the future, is disease prevention.
And let me ask you something, because I'm curious about this.
Right.
At what point does somebody need to sort of seek treatment?
Actually, that's an excellent question, Lauren. And the answer really simply is when it's a problem, right? When something gets in the way. If you're missing work, you're missing social activities, you're missing your kid's baseball game. Now you know it's getting in the way. Now, of course, when we're talking about some of these illicit substances, there is no safe amount of heroin, especially when you don't know what you're getting. A lot of times these things are being processed in somebody's back room. And so what's happening is that people are getting a mixture of various drugs, including the heroin, which really puts them over the top and leads to death.
But sometimes, of course, if you are an addict, maybe you don't recognize that you have a problem, but can people around you recognize that in you, and maybe you can offer some advice for family members too?
When you say that, it's not funny, but usually the addict is the only one who doesn't know. Everybody else notices. And another thing that's really important to keep in mind, Lauren, is that the readiness for change is a fluctuating product. You may be ready on Monday, but Thursday you're right back into it. So when somebody in trouble is reaching out for help, that's when we have to reach out and grab their hand.
And I would assume everybody's different. Are there some barriers to the treatment that you've come across?
Absolutely. What we find is that a lot of times people get on the medication and get into treatment, but they want to very quickly get off. Because there is a lot of stigma attached to addiction in and of itself. But what I tell people is this is no different than high blood pressure or diabetes. Somebody's diabetic, they're going to need insulin, let's say. We're not going to just take them off their insulin, but we do give them the opportunity and say, how about if you lose 30 pounds, walk 20 minutes, 3 days a week, stop smoking, stop eating processed foods, you get the point. How many of them actually do that? Not very many. And of those that do that, it takes time. So it's going to take a year, 2 years for the person who's addicted to get their life back together, to get a job again, secure housing again, to understand the mind, to build healthy relationships.
Dr. Raj, can you tell us about your new approach to manage addiction?
Lauren, one of the frustrating things for me over the years really was access to treatment for patients. Not just access to treatment in and of itself, but also access to high quality treatment. There's not very many addiction psychiatrists in the field, and there's not very many addiction psychiatrists or even psychiatrists in the country. So access was extremely limited. So what I built was what I'm calling an interactive remote treatment platform. And we built this application for the iPad mini for patients. So the patient will receive the iPad mini with this application on there. each week, there are a number of different things happening. Remember that the patient is out in the field. They're at home. They may be at work in their private office. And they're going to be having their one-on-one psychotherapy sessions remotely on their device. They're going to be having their doctor visits remotely on their device. And lastly, one of the most important things, they're going to be having their fellowship meetings on their device. So all of those things are happening on the device. But also what we're doing is we've included study curriculum, educational tools to help educate them on the mind, the body, and the spirit. Lastly, let me mention that there is something called a life map journal. Now, one thing I discovered is that many beginning counselors and therapists didn't really have a lot of experience under their belt. They didn't really know exactly what questions to ask always. So what I did is week by week, I actually identified, I gave them directives, questions to answer that then the therapist can now use to guide that session. There's been quite a bit of work done on understanding, who am I? How did I get here? How does disease work? What works for me and what doesn't? And of course, I'm not alone, because of the group fellowship experience. George Vaillant out of Harvard University identified that that was one of the most important pieces in the 12-step recovery process, which I'm an advocate for. But again, many people won't go into the rooms. They don't want to be seen in that public forum. So this gives you ultimate privacy.
So we've heard about the electronic medical records, doctor, and how confusing this can be. How does this work with your program? It's really a confusing topic for so many of us.
Well, the electronic medical record system now, where the whole country is moving, has now been given guidelines, or hospitals and other clinics and so on, prescribers have been given guidelines. That's what the HIPAA guidelines are. They're to protect the patient's private information. So one of the things I want to emphasize is this platform is completely HIPAA compliant, right? It's encrypted, so all that information is safe. One of the wonderful pieces of the back end where the clinician is, where we can look at the information of the patient out in the field, so to speak, is that we can follow their progress and even respond to, say, for example, a journal entry remotely. So say somebody did a journal entry last night. The therapist can go back in there. I can go back in there and say, can you tell me a little bit more about that? So it's a very interactive approach. Also, other clinicians, say your primary care doctor, also wants to be a part of the team. They can also follow your progress. So it really gives us a wonderful ability to actually share the data, because that way everybody's on the same page. Lastly, it really gives us the data in and of itself to help, again, bring to attention what's happening for this patient, such that we can individualize their treatment and really deal with it day by day in a very individualized boutique treatment kind of way.
And what would you say about, there's really sort of a stigma in our culture, those who are addicted, people don't really want to get treatment. Maybe they're ashamed, maybe they don't have access. So let's talk again how your program solves these problems, because it really does seem to be something that one can have with them and would not have to face those issues.
One of my patients, in fact, comes to mind where he said, he would never commit to going to a particular facility. He does not want to be publicly seen. He has a very public position. And so therefore, he just had not gotten into treatment. Now, this allows him to actually get treatment in the privacy of his own home. So that in itself is absolutely huge for some people.
And one more thing, because for those who are not technically savvy, as myself, I think it's important to let them know that this is a user-friendly program as well. Would you agree, Dr. Raj?
It's built in such a way that you can easily get into it and do what you need to do as far as the work is involved and get out. Absolutely.
Unfortunately, opiate addiction is claiming the lives of many in our country and doesn't appear to be going away anytime soon. Dr. Raj and his individualized approach seems to be tailored to a person's addiction and his or her individualized needs, and is certainly a tool that should be explored. I want to thank my guest, Dr. Raj Juneja, for providing additional information to this epidemic and explaining his approach. We wish him success in achieving a positive outcome for this large population of opiate addiction. Thank you so much, Dr. Raj.
Thank you, Lauren.